Welcome back to my YouTube channel. This is Erica, and I'm on a mission to support the well being of nurses. And in this video, I'm talking about boundary setting. I feel like nurses in all settings at some point in their career have had challenges with setting boundaries. I know that I have. Sometimes I feel good at it, and sometimes not so great. It's definitely been a process and a journey of evolving and growing to get better at setting boundaries. Especially since, as nurses, we are in the profession of service. We are called to give and to care for and to love and to help and to fix and to solve. And so we're constantly giving of ourselves, and often to the point of over giving or over caring at the expense of our own well being, sometimes even leading to burnout. So it's so important that we develop our skill set of boundary setting to help maintain our well being and to have sustainable, thriving careers in the beautiful profession of nursing. It is not always easy. Nursing is challenging. We have difficult patients and families that we work with, and colleagues and leaders, and our systems are not perfect. And sometimes we're transitioning to new positions and new specialty areas, and we're doing new certifications and academic programs. We're trying to rise up in the leadership ladder. We're starting off in nursing as new grads. So there's various points and stages in our career where we're not feeling as confident or where we're feeling burnt out and tired. It's harder for us to set boundaries. So we need to develop some tips and tools and tricks as to how we can set better boundaries as nurses. And I know for me, one thing that's been really helpful is really doing a lot of reflective practice and strategizing with myself on how that I can grow and in what areas I need to develop better so that I can be a stronger advocate of my own well-being in the nursing profession. And so I've done a lot of this work, and it's helped me to help identify the areas in which I need to improve on so that I can set better boundaries. And one of them has been to really look at my own sense of worth and value and really recognize how important and valuable I am to the profession of nursing, and that my voice and my body and my work matters and it makes a difference. And so I need to be operating at my best, and I need to care for myself in the best way possible. And part of doing that, of caring for me and of nursing myself, is setting boundaries. I look at it as a way of caring for myself by asking for what I need and by saying no when I need to. Another tip that has really worked for me is when I'm having a difficult time with setting boundaries and I'm not able to come up with a solution on my own. Sometimes it's because I'm in my own emotions and I know I'm not going to be able to phrase the words right if I need to approach a specific person. So it's helpful. What I found is reaching out to a mentor, a colleague, a peer, someone that I know is a champion of me being and doing my best work. And I've reached out to people and strategized around challenging situations to help get a new perspective, some ideas. It's especially helpful when nurses have more experience or maybe have dealt with that situation before or have worked with that colleague in that situation before and have some ideas on how to approach it better logically and from a professional standpoint. And also it's helpful to use resources, books and literature and evidence, and there's so many resources in nursing around this topic of boundary setting that we can use to also get the wording and the language to help set boundaries. Sometimes it's hard to just how to verbalize it, how to ask for what we need, and how to say no, because we're so used to saying yes. And how can I help? And what can I do for you? What do you need? It's very comfortable doing that. When we turn the fingers to us and we have to use those words to advocate for ourselves, it cannot be, sometimes it's just not as easy as others. Another thing I found really helpful has been to use positive affirmations. And one affirmation I got from Dr. Deepak Chopra, who is a guru in alternative medicine. And it really helped me at times in my career when I wasn't as confident and when I was struggling. And I would say these words: I am superior to no one and inferior to no one. I am fearless in the face of all challenges. And this quote was extremely helpful in just reprogramming my thinking to be more positive and to have the confidence to really rise to the occasion and know that I matter and to know that I could advocate for myself and to get the energy behind it to do so. So I encourage you to try that one out or another affirmation of your choice. So there's just a few tips. Hopefully, I've been able to inspire you to either work harder on setting boundaries or to start reflecting on how you could grow and develop your skill of boundary setting. So please advocate for yourself as nurses and set the boundaries you need so that you can have a really beautiful and lasting and thriving career in nursing while still feeling good and like you're being cared for in order to do your best work. And in the meantime, always take the time to nurse yourself.